Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to the program Health Check, a program where we talk about matters concerning health. I am Naima Senfuka, your host today, and in today's episode we will be learning about ultrasound scan. In this very episode, we are going to be learning the definition, why is it inevitable to do away with ultrasound scan, its importance, and how many times should one do it. Our dear viewers, with me in the studios today is an expert, a doctor who is going to be taking us through today's discussion. She is Dr. Ndagile Mariam, and she is an expert who is going to help us digest about ultrasound scan. She holds a bachelor's degree in imaging radiography, and she currently works with Nakasero Hospital and St. Francis in Zambia, and thus she is a medical imaging technologist. Before we proceed any further, our dear viewers, we would like to bring to you some of the views of our viewers about the ultrasound scan. Mugisha Umar, who is our reporter out there, is going to bring to us what our viewers have to say about ultrasound scan. Mr. Mugisha?
Thank you very much, the moderator. Right now, I'm at YMCA campus, as you can see all around here. Basically, we would like to hear about the people's views about the topic of discussion today. And as I'm walking around, I can just meet with this lady. Hello, how are you?
Hello, I'm fine. How are you?
What's your name?
My name is Alitsavila Encharon.
Okay, Rachel. We are trying to look at scan. Like at times, women need to go for scan. Pregnant women, what and what. What do you have to say? Should these women go for scan?
Obviously, yes, because sometimes it helps the women to know which kid you have, and sometimes they have miscarriages. Like some of them use family plannings, and maybe some complications are there. So it is really much more better for you go for a scan, such that you know which baby are you having, any problem within the baby in the stomach, such that you're ready to have a baby in a good condition. Where if you go in a scan, you'll be ready for your baby, and you know what the baby, like in case he's having any disease, you're ready to at least get some medication before time goes worse.
Yeah, there are some scenarios where you find a mother is not financially stable for a scan. At times, scans are very expensive. What advice would you give to such a mother or to such a couple?
To such a couple who are not financially stable, I think we have big grandmamas, those ones who are more experienced. I think those ladies, or for example, it is me, go to them, talk to them and tell them I am pregnant. They know how to cross-check using their very, very hands, such that you know how the baby is. Sometimes they touch you, and they're in position to tell you what the baby is.
I've liked that. I've liked that. They touch you so that they can understand the nature of the pregnancy you're having.
Yeah, it is really so important for us ladies to visit them, because sometimes, for example, it is a young girl, moreover 18, you know nothing about pregnancy, you know nothing about giving birth. You should make some good research, such that you're capable of your baby, because this baby is more important to your life.
I wish we shall get you back and we have a discussion with you.
Okay, thank you so much.
You're welcome.
And you're most welcome at YMCA.
Thank you.
You're welcome.
Okay. Yeah, thank you very much. That has been the views from our people, from the people we have tried to collect around the campus and on the street. I will turn the attention to the moderator in the studio.
We shall get back to you, Mr. Mugisha. Doctor, you're most welcome to the program.
Thank you very much, madam.
We would like to know, what is ultrasound scan and why is it relevant according to your own perspective?
Ultrasound is an imaging modality, and it uses ultrasound waves to help us to see clearly what's happening in our bodies or our patients' bodies. So it doesn't deal with X-rays.
Okay.
It's merely merely sound waves that we use that vibrate and cause organs in the body to release images that we can interpret and later diagnose diseases.
Okay.
So ultrasound is important, first of all, because it's a preliminary test that we can do.
Okay.
It is cost effective. It is there's a close interaction between the patient and the imaging technologist. In other words, you can easily open up with the patient.
Okay.
You can talk to them and further know what their problem is as compared to other imaging modalities, because others need a distance between the operator of the machine, who is the imaging technologist, and the patient. So interaction may not be really that much.
Okay.
So we need ultrasound because it is cost effective. There's no danger to life. There's no risk of endangering one's life because the ultrasound waves are really harmless. There's no effects to the human body.
Okay.
Yes. So as a preliminary test, and it being cost effective and it being okay or doesn't endanger life, I think we need it to further diagnose diseases.
Okay. Thank you so very much, Doctor, for telling us the relevancy of ultrasound. So how many times should one do it?
It depends on the situation or the disease that you're trying to look for or diagnose. It doesn't have any harm.
Okay.
By that, any time a person wants to do an ultrasound, they can always come in and work on them. It has no harm. It doesn't have a limitation to a number of times you can do it.
Okay.
Anytime you want a scan, ultrasound scan that is, you can always come, or you can go to any hospital that has that machine or that modality, and you'll be worked on. There's no limitation to the number of times you can do it.
Okay, so you can do as many as you want.
As many as you want.
Okay.
Yes.
Thank you so very much. Doctor, you've talked about its relevancy and you like someone can do it a number of times. Okay. So when we look at the mothers, the expecting mothers, they're always advising hospitals to go for ultrasound scan. What should a mother expect in the first trimester?
Okay. First of all, trimesters, we grade them for every 3 months.
Okay.
That means if we're talking about the first trimester, we talk about from the time of conception, that is around a month. Oh, okay. From the time of conception,
okay,
either day or from the day of conceiving the baby to the 3rd month of pregnancy. So the time period between 1 month to 3 months, or the day of conception 3 months, that's the first trimester. So during that first trimester, when you come to ultrasound for an imaging, and your doctor or gynecologist has sent you to us, what we shall look for first of all, is it true you're pregnant?
Okay.
Usually, mothers before they come in, of course, you've missed your menstruation period. The first thing that clicks to your mind is, oh, maybe I'm pregnant.
Okay. Then
secondly, you do a test, HCG test, to confirm urine test or a blood test, any. So we look out for the location of the pregnancy. We look out for aging of the pregnancy. The very first scan, we shall tell you, okay, now according to ultrasound,
okay,
this is the gestation age of your pregnancy.
The number of weeks it has.
The number of weeks
okay,
it has. Then secondly, we shall tell the state of your uterus. Is it okay? Will it manage to carry the pregnancy? Are there any fibroids that we will have to look for or to look out for in the following scans? We look at your cervix. Is it open or is it closed? Is there any danger to the pregnancy that is in the uterus? We also look out for things like, in case the pregnancy is not in the uterus.
Okay.
That is called an ectopic pregnancy. Where is it located? Is it manageable? What are the management? Okay, finding out the location of ectopic pregnancies helps the doctor, your obstetrician, plan the management in case it is an ectopic pregnancy. First of all, is it located? Is it in the pelvis? Is it in the abdomen? So that's basically what to expect in the first trimester.
The first trimester.
Yes.
Thank you so very much, Doctor, for that beautiful elaboration about what a mother should expect in the first trimester. Our dear viewers home, hope the program is not doing you anything but rather it is an interesting one, and I hope you're learning. For your questions, comments, or observations, you can reach us at our email address, africa@mta.tv. That is africa@mta.tv. Doctor, still back on that very issue, because we have talked about what a mother should expect in the first trimester. How about the second trimester? What should a mother expect in that second one?
Okay, so second trimester starts from the end of the 3rd month.
Okay.
To the 6th month. Remember, we are doing this in levels of 3 months each.
Okay.
So what we expect from the end of the 3rd month, that's the 12th week, to the 24th week, that's 6 months.
Okay.
Now we shall look for a nucotranslucency measurement. Nucotranslucency is a measurement that we do. There's a space at the back of the baby's head,
okay,
that we measure. What's the importance of that? There's a limitation to the measurement of that space behind the baby's head.
Okay.
In case it is higher than the range, then we suspect that the baby might have abnormalities.
Okay.
For example, they may have Down syndrome. They may have all those trisomy 21 abnormalities.
Okay.
So that helps us plan for the baby as we go on. So the normal range of that measurement, the nucotranslucency measurement, is usually less than 3 millimeters. So if we find that it's greater than that, we shall notify the obstetrician, who will further manage the baby accordingly. That's one of them, the importances of the second trimester. Now we've proceeded. Now that is usually between 11 weeks to 13 and a half weeks.
Okay.
We cannot do nucotranslucency test or measurement past 14 weeks. We cannot.
And so that implies for those that go very late, that has passed already, they cannot do it.
It has passed on, we cannot do it.
Okay.
Why? As the baby grows, that space behind the neck tends to increase.
Okay.
So if you come in late at 15 weeks, 14 weeks, 0.5, 15 weeks, and so on, it will be inaccurate. We shall get the measurement as higher than 3 millimeters, which that implies that there's a problem with the baby. Yet in actual sense, you've just come in late past that date, or we're supposed to do that scan.
Okay.
And it's actually inaccurate. So that's why we emphasize it's always between 11 weeks and 13.5 at most.
Okay.
Yes.
Oh.
So as we proceed, because first trimester is not yet done, now we shall move on to 20 weeks now. So 20 weeks is 5 months. So at 5 months, that's when we do a fetal anatomy survey.
Still in the second trimester?
In the second trimester.
Okay.
Because remember I told you the second trimester spans from 12 weeks, the end of the 3rd month,
okay,
to 24 weeks at the 6th month, right? So at 20 weeks, that's 5 months. So we tend to look out for the anatomy of the baby.
Okay.
Does the baby have every organ? Does it have a head? Does it have eyes? Does it have both hands? Does it have both legs? Does it have a stomach? Does it have a beating heart? So basically, every part of the organ, every part of the human body, is it already formed? Basically, that is it. So fetal anatomy scan, we are focusing on the organs of the baby. Are they well developed? Is there any abnormality? Is there something missing?
So that they can plan early enough if there is any abnormality.
Yes, if there's yes. They prepare the mother, and the doctor prepares for whatever decision the mother has to do upon their baby. Yes.
Thank you so very much, Doctor, for taking us through what should a mother expect. You've said it all in the second trimester. Yes. My dear viewers home, it is very relevant for you if you are an expecting mother to go for these ultrasound scans. Because if at all a baby has abnormalities and you skip one, it will be very difficult for the doctors to help you out. Let us proceed, Doctor. How about what should a mother expect in the 3rd trimester? Because they always tell us 3.
3, yes.
What should a mother expect in the 3rd trimester?
So 3rd trimester spans from 6 months. That is 24 weeks now to 40. Because now for us medically, we measure as full gestation is 40 weeks. That's 10 months. So now the third trimester will carry from 24 weeks to 40 weeks.
Okay.
So basically, third trimester is more about looking for the fetal well-being. How is the baby doing?
Okay.
Is the baby okay? Is the baby gaining weight? Heart beating, yes. Where's the the umbilical cord? Is it in the neck? Is it not in the neck? If it is in the neck, how many? Is it tight? Is it not tight? Does the baby have enough fluid around them? What we call amniotic fluid, or the liquor. Is it enough? Is the baby position of the baby? Is the head down or not? Is it up? We look for other fetal movements. Is the baby breathing? Basically, how is the baby doing? Is the baby gaining weight?
Because doctors usually ask, do you hear any movements? Does it kick around?
Yes.
Okay.
So that's why basically the third trimester is more really finding out how is the baby doing. Is growth going on as expected?
Okay.
Yes.
Thank you so very much, Doctor, for taking us through all those trimesters. There is something else I would like to ask you.
Yes, please.
Is there any specific ways that a mother should prepare for these ultrasound scans? Because there are 3 times.
Yes. Okay. For each level, there's preparation needed.
Okay.
For the first trimester, since the baby is still young, we need a full bladder, a urinary bladder. In other words, you have to come in and take water.
Okay.
Or any drink of convenience, because you know water is not a really easy drink to take. So you come in with a full urinary bladder. It doesn't matter what drink you had, whether tea, whether water, whether juice, whatever it is, but just have a full bladder. Why? The full bladder helps us clearly view the pelvis and everything in it. It gives us, it's like a window to us to see what's in the uterus, what's in the ovaries, what's in the cervix. If you don't have a full bladder, we really can't help much. That's why we always emphasize, please take some water before you work on you. But people tend not to understand the importance of taking water. But it is very important, because if I work on you with a half full bladder, I may misdiagnose. I may tell you something, everything is okay, there's something wrong, and I miss out.
Yes. Okay.
So that's why we ask that please come in with a full bladder, let us know. I cannot give you, a person working on should not give an expected time. Why? They don't know how your body works or how quick you form urine.
Okay.
Yes. So it is upon you, whom we've told to take water, to tell us, okay, now I feel ready. So there's no time period that, okay, take this water and after this time, come in. No, it's upon the person you've instructed to tell us that, okay, now I think I'm ready, I can be worked on.
Okay.
Yes. So for the second trimester, so for the first trimester, it's always a full bladder. Okay,
you have to take adequate water before getting in.
Yes. Yes, so full bladder, of course, with the doctor's request for the scan. Basically, that is it. You can eat, it's fine. For mothers, it's okay. They can eat because they're looking at the pelvis. It's okay, so they can eat. Second trimester, we still have, we need a full bladder. Why? We still want to look at the cervix.
Okay.
Yes, it's very important. And to see the cervix, we need always in the full bladder, urinary bladder, that is. So second trimester, we need also a full bladder. I think that is it. They can eat, mothers can eat, it's okay, because it's not good to keep them hungry, so they can eat. Maybe something hygienic that some people, not all of them, but some people need to look out for, is try and clean the area that we are going to expose towards them. Of course, we are doctors and we are used to that, but I think it's like a bonus if you work on a patient and they are, they're hygienic. They've shaved and, yes, we are used to them, but it's a bonus. You feel, okay, now you understand the person who you're working on because they are clean. It's just like a bonus.
Okay.
Then the third trimester, there's no need for anything. There's no preparation. You just come in. Usually third trimester, it's rare that we look out for the cervix. Why do we look out for the cervix usually? One, sometimes cervix can be open. It can open up, and it risks having a miscarriage. Secondly, a cervix can have the placenta sometimes can be low-lying.
Okay.
And mothers sometimes tend to experience bleeding or spotting in their pregnancies. So if you have a full bladder, we assess it, the cervix, and the location of the placenta. How far is it from the cervix? So that's the importance of having a full bladder majorly. Looking at the cervix. Because the baby, as long as the baby grows, we can always see the baby clearly. It's okay.
Okay.
as the baby grows. But just the full bladder, in case we ask for a full bladder, maybe you had, now for example, a mother may come in the 3rd trimester. Like I told you, they may not need a full bladder, but if the person had history of an open cervix before, or they had history of a low-lying placenta, which we may call placenta previa, or a marginal placenta or a low-lying placenta. That way, we're doing a follow-up scan to see how far the placenta is. So if that mother has been consistently having a low-lying placenta, we shall need to have them have a full bladder, even in the 3rd trimester, to try and look out for that placenta and the cervix, you understand? So basically, that is those are the preparations that are needed for ultrasound.
Thank you so very much, Doctor. Our dear viewers home, you have had it all. There are those specific preparations for each and every trimester. Doctor,
Yes, please.
is there no side effects after all these trimester scans? Because someone has to go in for a scan during the 1st trimester, the 2nd, and even the 3rd. Are there no side effects after all those trimesters?
Not really. There's no side effect. Babies' genes or the skin or their life is sensitive. So there's no way we could put a baby at risk. There's no way we can put a baby at risk. So ultrasound is really safe. It is safe for everyone. It is safe for the person working on you. It is safe for the mother. It is safe for the person, for the attendant you've come with. It is safe for the baby. So that's why I told you earlier on. However many times you come in, it is okay. We shall always work on you. We shall never object to the scan because it's really harmless. Yes, there's no side effect.
Okay, thank you so very much, Doctor, for enlightening us about that. Because majority of the expecting mothers have that in mind, that it is very dangerous. How am I supposed to go there 3 times, you know? It could be dangerous. So thank you for enlightening us about that, that there is no any danger. You can do it as many times as possible. So Doctor, before concluding, because we are running out of time, do fathers have anything to do during this period, or it only lies with the mother and the medical personnel?
Well, fathers play a very big role. As expectant mothers, they're mentally, they may not be, okay, how can I put this? Fathers will always act as a pillar of support to the mother. It is very important. In case, because you know, when a mother comes in for ultrasound, you can never know what we are going to find. You cannot predict. So anything can happen. And if we found very bad news, for instance, who is going to be her support system?
It's going to calm her down.
Yes, we can do that. But as a person, as humans, you need the person you know, a person who is close to you emotionally, to comfort you during that trying moment, before even you go back to the doctor, because now we deliver the news to you first before you proceed. So fathers majorly act as a support pillar to the mothers during the scan. Secondly, for mothers in the 3rd trimester, it's important to always come in with an attendant. Why? It helps, especially the fathers, because I mean, or anyone anyway, but the fathers, it prepares them to know, okay, now how is the baby doing? Does the baby have a NICO code? If the baby has a NICO code, what should we be ready for anything to happen? Does the baby have enough amniotic fluid? Should we prepare? You understand? What are the risks of this? What are the risks of the baby being, the head is up? What's the risk? So it helps fathers plan, whether financially, whether physically, to support the wives when there is need, or when the time for need comes, to prepare. Yes, because they need, as mothers tend towards the end of pregnancy, they're using the support system with them all the time, because anything can happen, an emergency can happen anytime. Yes.
Thank you so very much. Fathers, you should always escort or accompany your wives as they go for ultrasound scans. It is really very important, as the doctor has said it. We are running out of time, Doctor, but in a few words, can you try to advise and guide the expecting mothers out there, the need for the ultrasound scans, because majority of them are biased because of the number of words, or for quite a number of words they hear from their colleagues or in the society they live in, how best can you advise them to take on the need for ultrasound scans?
Yes. First advice I would give my expectant mothers, stop listening to the public, because most of the time they do not have the professional knowledge to what happens in the hospital. So I think the best would be walk into the hospital, inquire from the medics you find there of what is really the importance of ultrasound. Because people, it's rare that you find a person who can properly differentiate between CT scan, X-ray, MRI, and ultrasound, because all of them have the word scan. So the person tells you, I'm going for scan. People usually think it's X-ray, and of course X-rays are not good. So that's why they tend to, if a person is not well informed, they'll discourage the mother from actually coming, but yet ultrasound really has no issue. So secondly, mothers, please, if you find that going into hospital more than thrice a month, trimester is hard, at least try once every trimester. Why? Because for every stage of pregnancy, that is for every trimester, there's something that we look out for. And it is very, very important. It is very informative for both you, the mother, and your doctor, your obstetrician who's working on you. So please try as much as possible and go for a scan at least once every trimester to find out how the baby is doing, to find out is the pregnancy viable, to find out is the baby well developed, do they have everything. It helps you further plan for the future. Yes, I think that is majorly what I would advise. That's the most important thing.
Thank you so very much, Doctor, for that advice. Our dear viewers home, that's what we had for today. You've heard it very well from the doctors. Please, mothers, do not hesitate to go to hospitals for ultrasound scans. Consult from the medical personnel. They will help you out, other than listening to the public, because they might not be knowing the very exact thing about ultrasound scans. I'm not going to proceed with the program. The time has come to an end. I remain Naima Sefka. Thank you so very much for watching this program. May the good Lord bless you abundantly. Assalamu alaikum wa rahmatullahi wa barakatuh.